I'm now joined by Knights of Columbus Vice President of Public Policy, Tim Saccoccia, to talk about these latest poll numbers and the cause for life. Tim, thanks for being with us. Good to see you.
You too, Jonathan. Thanks for having me.
So, maybe we should just start with saying, what is the Knights of Columbus Marist poll? Just give us some background on that and why it's so important.
Sure. So the Knights of Columbus have been partnering with the Marist Institute for Public Opinion, based at Marist College in Poughkeepsie, New York, for about 15 years now. And what we've been trying to do for the last 15 years is to really do a deep dive study into what Americans' opinions on the abortion question really is. So, for instance, we know Gallup and a lot of other great polling outfits, they do these polls. We see them regularly. There's always one coming out. Are you pro-life? Are you pro-choice? And what we found over 15 years is that's not really answering the question of where most Americans are on this very critical and deeply dividing issue. And what our polling is actually finding is it's not deeply as dividing as sometimes we find. So we start with that question, but we go deeper. And we ask questions about particular policy, questions about particular limits, questions on state issues, federal issues, and so that we really now start understanding what Americans think. And I think it's critically important because that's not how this issue is often reported. And so we're able to add to that discussion. We're able to add to an intelligent way to the debate so that we actually are talking from facts and not just suppositions on the issue.
So, Tim, I've heard you talk about this before, and you've mentioned something, you've used this phrase, ProLife Consensus, and you said this has sort of been steady throughout. What do you mean by that, and what does it tell us about the last 15 years?
Sure. So after we ask that initial question of whether a respondent is pro-life or pro-choice, what we then ask is, okay, well, here are 6 possibilities for policy on the abortion issue. Which one comes closest to your opinion? So we ask, do you think it should be legal without limit, that it should be completely illegal? And then we ask a few questions in between as well. We call it our 6-way question. And what we've found consistently over the last 15 years is that if we draw a line around whether someone thinks there should be limits on abortion starting at 3 months or in extreme circumstances like the life of the mother or other such issues, we find that that number comes in at or above 7 in 10 Americans. So this year, 69%, just about 7 in 10 Americans would favor policy that limits abortion to the first 3 months of pregnancy or only in extreme circumstances. But our pro-life and pro-choice question indicated that about 60% of Americans or so called themselves pro-choice. So what we're saying is that this isn't really answering the question on where the American people are, but that there's actually a pro-life consensus that most Americans kind of are innately leaning more in a pro-life direction on policy, and that we bring this up to our legislators, to the media, to our brother Knights, to the American public, to let them know that really there's a bit more nuance to this issue than we're hearing about. And so we start there, and then we start diving a bit deeper. What does this really mean? So we ask questions about federal policy and other issues like taxpayer funding, where we find 60% of Americans don't support taxpayer dollars being used to fund abortion. So this would be the federal Hyde Amendment that I'm sure a lot of Brother Knights and listeners have heard about before, that restricts funding for abortion in the labor, health, and human services space, so Medicaid and other such programs like that. And this is something that is popular among the American people, but not maybe something that we hear about as often. So this consensus, we know, really kind of goes to the core of where the American people are, not just Catholics, not just Republicans, not just independents, but really a bipartisan consensus on the issue.
Did the Dobbs decision change any of this? I mean, we put Roe versus Wade aside. Did that change your polling?
So for this year, it didn't. In fact, actually, our numbers are about the same as they have been, that, again, being very consistent or better. We ask a question about whether laws should seek to protect the unborn child and the mother where possible. Typically, that's come in very strong in the low 80, 81, 82%. This year, it was over 90%. And so there are a lot of other numbers that have increased. The taxpayer support that I mentioned before have gone up as well. And so what we're finding is it's consistent or even a little bit better.
This strikes me as particularly important now, Tim, because as the conversation gets more emphasized at the state level, we're not abandoning the federal level. There's a lot to be done here. But now that we're having state conversations about these and state marches, which I want you to talk about a bit, tell me why it's so important we participate in those marches and why this information is now so important at the state level.
Yeah, I mean, so practically speaking, things are important at the state level and the federal level because what the Dobbs decision did, in its own words, is to return the issue to the people's elected representatives. And so that's state, federal. It's even in some areas where there may be opportunities, local, municipal situations as well. But at the state level, the states can regulate the medical profession, and so there's a lot of responsibility there on state legislatures to do that. Some states have responded in a pro-life direction. Some have responded in a way to expand abortion, and so then that also gets to the two issues you mentioned. One, federal need. There are federal issues like taxpayer funding, which has the support of 60% of Americans on domestic, over 70% when you go to international funding. So there's a federal role there for sure. But at the state level, we need to make sure voices are heard. And so, of course, we've marched in Washington now since 1974, and we'll continue to do so. But marching at the state capitals is important as well, as state legislatures consider these legislative questions. But there's also a cultural kind of moment to it as well, to let legislators in red states, blue states, purple states know that people care about this issue. They care about it. They're pro-life. And they want their elected representatives to know about that.
I think it's important you bring up Washington, because there was some question, and you and I had these conversations with a lot of our friends about what's going to happen to the March for Life here in Washington after the Dobbs decision. After all, as you said, it was primarily a response to the Roe versus Wade decision. Were you surprised about what you saw here in January?
I wasn't. I always had hope that it would be one of the biggest and most successful marches in history, and I think it was. The march was started in 1974 in response to Roe. The organizers, thought it might just take a couple of marches to change the tide. There were talks of constitutional amendments in the earliest days after Roe, and of course that didn't happen. And so the march really became an opportunity to change hearts and minds, in the words of the March for Life, to unite, equip, and mobilize the pro-life movement. And so that's what the March for Life has really become, a rallying point, an opportunity to come together, to look around and to see other people who are concerned about this issue. And so that's the role of the march now, kind of after Dobbs, post-Roe, to continue to change hearts and minds, to build unity. But it's in January. And so then we can go forth into the states during the rest of the year to bring that message into state capitals. And so the March for Life organization has organized now upwards of 10 state marches, and over the next 5 or 6 years, hope to be in all 50 states in the District of Columbia as well, to be able to advocate for life and to speak out for life.